Malignant gliomas and other aggressive brain tumors are often a fatal diagnosis for patients. There is no known cure, and survival rates are typically 1 to 2 years with current treatment methods. Although animal studies in mice with gliomas have demonstrated that extended delivery of medications using simple implantable pumps can significantly increase survival, no implantable pumps have been developed for human use. Pharmaco-Kinesis is determined to change this current problem. By first applying its magnetic breather pump technology to conditions such as gliomas and other aggressive brain tumors, PKC will be addressing a market in which current therapies are known to be inadequate. Therapies where patient care is already very expensive in both monetary and human cost. The medical, scientific, and world regulatory communities are all looking for and receptive to an innovative and therapeutic approach that will allow physicians and oncologists a safer, more effective, and lower-cost option to today's treatment standards. In this video, Dr. Thomas Chen, PKC's Chief Oncology Officer, discusses current brain tumor treatments from his appearance on the Heartbeat of America program.
Now, I'm Doug Llewellyn here in our studios in Los Angeles with our guests who are from a company named Pharmaco-Kinesis, headquartered in Inglewood, California, here in the Los Angeles area. You're about to hear about a unique medical device development going on that this company is creating that could have great ramifications for the entire field of medicine, especially the field of oncology, because this company is developing an implantable brain tumor pump, and we're going to find out now just what that can do and why it is so important. I'd like you to meet the key people behind this company. First, on my left, Dr. Thomas Chen. He is the Director of Neuro-oncology at the University of Southern California. He is also an Associate Professor of Neurosurgery at USC. And on his left is the President and the CEO of the company, Frank Adell. Welcome, gentlemen. It's a pleasure to have you with us.
Thank you, Doug.
Dr. Chen, let me begin with you and ask you, what is the importance of a device like this, an implantable brain tumor pump?
Well, this pump is really designed for treating a disease that's currently not curable. Brain cancer affects 18,000 Americans every year, and the most common type of primary brain tumor is something called a glioma. And a glioma is a tumor that some of you might have heard about. That Senator Ted Kennedy was recently diagnosed with a glioma.
Right.
But basically, in our brain, there are 3 types of cells. We have neurons, and we have astrocytes, and we have endothelial cells. The neurons are what most people know about, and they form what's called the gray matter of the brain. And the astrocytes are involved with the white matter of the brain, and the endothelial cells form the blood vessels. And what I did was I brought over a model of a brain to show you what that involves.
All right, why don't you open the brain up and show us a little bit. The camera can get a good shot of that.
Okay, so this is a model of a brain. And basically in our brain, what I'm going to do is I'm going to open this up here.
Okay.
This is what we call a coronal section of the brain. And what you can see here is that this here is the gray matter. That's where the neurons are. The white is the white matter, and that's where the astrocytes are. And then here are the blood vessels where the endothelial cells are. The tumor that we want to treat with this brain tumor pump are what's called gliomas, and they're basically mutations in the white matter of the brain.
Okay. I don't know a whole lot about the brain. Not many of us do. You are a brain surgeon.
That's correct.
Not often we talk to a brain surgeon. The importance of the implantable pump, is it possible then to really treat the tumor so that the patient can recover?
Well, here's the thing about a brain tumor is that, you know, the brain is what we call an immune privileged site. And so what it has is that there's a barrier called the blood-brain barrier that separates the brain from the rest of the body.
Okay.
And it's a good thing, but the thing is that when you try to deliver chemotherapy or other drugs to the brain, this blood-brain barrier often keeps those agents out. And so therefore these patients do not benefit from IV chemotherapy as we normally do for patients with breast cancer or lung cancer. And so one way of trying to get around that is to, instead of giving the drug systemically by intravenous administration,
right,
is to deliver it directly to the brain.
Right into the tumor itself.
Into the tumor itself, exactly.
And it can do this without harming the other substance around the tumor in the brain?
Yes, that's the goal, is to have this pump directly inside the tumor cavity,
yeah, and
be able to deliver the drug directly into it. Now, what I did was that I brought over a little, some slides to show you as to some of the current treatments that we have for brain cancer.
Right.
And then what I like them to do is to show you how this pump can be used to revolutionize the treatment as we have it right now.
Well, let's do this. Let's take our viewers through this. I've seen this. It's pretty fascinating indeed. So, Doctor, go ahead and open up your computer. If you want to slide it around a little bit to make it more convenient to reach,
okay,
that's fine. You may want to angle it a little bit more toward the camera. There, all right, there we go. Now obviously we have a pretty tight shot here of a brain.
Okay. So what I have here is, this is what we call an axial view.
And if you look for the little white dot moving around, that's the image, that's
right,
what we want you to focus on.
And what you see here is, this is a cross-section of a post-mortem brain from a patient that died with a brain cancer. Now, do you see this part right here? This part here is the glioma. And what the glioma is that it's a cancer within the white matter of the brain. And you see how this cancer has spread across to the other side of the brain. Now, the reason why these patients are not considered curable is because, as a surgeon, we can cut out portions of the tumor, but what happens is that the tumor usually recurs and then spreads into different parts of the brain, so that it becomes impossible to take out the tumor and cure it.
Completely. You can't get it all out.
You can't get it all out.
I'm prompted to ask you, what effect does the tumor in that person, what's it having on the person themselves? How are they being affected by the tumor?
Well, a large portion of how they're affected depends on the location.
Right.
And so these patients will oftentimes present with headaches. They may present with some memory loss. They may even present with a seizure. Or they can present with weakness on one side of the body, or sensory loss on one side of the body. It just depends on where it's located.
Obviously, it's having some impact on,
exactly,
on them. Okay.
Now, currently what we do for resecting these gliomas is that what we have is that we often use what we call as a neuronavigational device. And a neuronavigational device is sort of like your intraoperative GPS system.
Okay.
So the patient basically gets an MRI scan prior to surgery, and then what we can do is that we can register via this wand his skull and his tumor. And after it's registered, I can point to any area of his brain, and it will show up as a dot here on this crosshair on his MRI scan.
Gotcha.
And that allows me then to say, oh, this is exactly where I am. And because of that, what we are able to do is that before surgery, I am able to map out this tumor like this, and then I can plan out the incision that I would like to make that's tailored according to where the tumor is precisely located.
Now, this is the side of the head, right?
That's right.
That's
side of the head, and this is the ear that you see.
Okay.
This is the patient's tumor, and then this is the planned incision that we're going to make for his craniotomy.
Okay.
And so here's a picture of what we do during surgery, is that we use something called an operating microscope, where we're able to look down under magnification onto the tumor itself, and we use something called a bipolar forceps, where we coagulate and cauterize the tumor before we remove it.
Okay.
And so here's a picture of a brain, and you see here's the brain, and these are some veins in the brain, but this is the area that has been worked on. And here I am placing some what we call Surgicel, which are hemostatic agents, into the cavity that has been recently operated on.
Now that's where the tumor was?
That's where the tumor was, that's right. So let me give you an example of a patient with a glioma. You see this patient here? She has, this is a side view of this patient's head.
Right.
And this is her eyes right here.
Right.
And you see this area that lights up? This is an MRI scan with gadolinium, which is the contrast. Now the contrast lights up the brain tumor. Okay, so all this white area is her tumor. And here is another view of her tumor. This is what we call an axial view, where we're doing a cross-section. But you see how this tumor basically takes up this side of her brain?
It certainly does, yes.
And what this is that now what we have done is that we have done on this patient something called craniotomy, and what you see is that this is the exposed side of her tumor, and this is her tumor that's right here.
That whole thing is the tumor?
Exactly. This whole thing is the tumor.
That's a large tumor.
It is a very large tumor, and this adjacent side is some of her normal brain. Now, what we do during surgery is sometimes these tumors are located in important areas of the brain, and this is something called a Olgerman stimulator. And what we do is we stimulate different parts of the brain to see if it elicits a motor function.
Whether a leg moves or an arm or whatever.
Exactly.
Right.
So this would tell me, oh, this is not a part of the brain that we want to be operating on.
Okay.
And this is what it looks like after the tumor is removed. You see this fairly large cavity here?
Yeah, can't miss it.
Yep, and so this is cavity is lined with this hemostatic agent into the cavity itself here. And then now one of the modes of treatment that we have currently for treatment of brain cancer is that we place what we call chemotherapy wafers. And these wafers basically have chemotherapy impregnated into them.
Okay.
And the idea is that after surgery, some of the chemotherapy that's in these wafers will leach out and attack some of these tumor cells that are on the side. Okay. But the problem with this type of delivery system is that everything is passive. So the chemotherapy only goes out a few millimeters. So, but the cancer could be a few centimeters away.
So it's not reaching everything.
It's not reaching everything. Exactly right. So then what some people did was that they said, well, if it's not going to reach something, the tumor, is there some way of delivering chemotherapy or drugs to the tumor in a more, in a more direct manner?
And that's where this pump comes in.
Exactly. Now let me show you the.
I tell you what, before we get to the pump, let's take a brief pause, and then we'll be back and we'll see the application of the pump that this company, your company, is developing at this point and how it might be used.
Great.
Good enough?
Thank you.
We'll be back in just a moment. This is fascinating. We are back again with our guest from Pharmaco-Kinesis, this unique medical device development company headquartered in Inglewood, California. I'm here with our guest, Dr. Thomas Chen, who has been leading us through the story of how you treat brain tumors. And on Dr. Chen's left is Frank Adell, who's the president and CEO of this company. Frank, I promise we will hear something from you before this evening is over, okay?
I'm looking forward to it.
Let's get back to Dr. Chen now. We're about to see how the implantable brain tumor pump can be used in treating brain tumors. Let's continue, Doctor.
Well, what I was talking about was that because of the fact that we don't have an active way of delivering chemotherapy to the brain, people have been looking at using catheters where we can pump drugs into the brain tumor.
Right.
And this is a technique that is called convection enhanced delivery. And what you see here is that this is one of the catheters that we use. So this catheter you see has a hole in it, and this is the catheter that is placed into a brain tumor. And the catheter then delivers drug out of this port here.
Right directly to the tumor.
Exactly.
In the brain.
In the brain. And so the idea is that the catheter tip comes in, and under direct pressure, drugs are pushed out, and it goes out into a certain circumference within the brain tumor. And so this is using that neuronavigational system that we had shown, but what we're doing here is planning trajectories for how to optimally place these catheters into the brain tumor. So you see this gray area here? That's basically a tumor, and this yellow line is a trajectory for a planned catheter placement into the tumor.
Very good.
Now the problem with all this technology is that when we place a catheter into the tumor, it's basically externalized. What that means is that the catheter goes in the tumor and then the catheter comes out. The catheter is then hooked up to a pump, which is external, right, and that pump then delivers the chemotherapy into the tumor. Now, the problem with that is that you can't leave that in the patient forever because it will get infected.
And the patient's continually attached to this pump.
And the patient is continually attached to this pump.
Right.
So usually what happens, like in some of the trials that we have run, we have to take the catheter out after about 5 to 7 days. Now, if the patient is getting good benefit from this treatment, we then have to bring the patient back and drill another hole and pass another catheter into the tumor for another cycle treatment. And that to us is, just basically adds to the number of days the patient's in the hospital, adds to the patient's potential morbidity, the surgery, and also inconvenience of the procedure. And so what we thought was that why not take a pump where everything is implantable, and that what you can then do is that you can place your chemotherapy of choice into the pump. Right. The pump can then be used to deliver that drug right into the tumor. And our vision is that this pump would then be able to be controlled from using a Wi-Fi device so that we can control what we deliver right into the tumor. And we can even control the cycle and the duration of the treatment. And moreover, what we would like to do is that we would like to be able to sample fluid from the tumor, and the pump can then analyze how the patient is doing with his treatment. And so what I did was that I brought over a video representation to just show you how this pump could work.
Now we're watching, so this has been in development for a long time now, right?
Actually, it's been in conception for about 10 years. Yeah. And we have basically over the past 2 years have been actively creating the prototype of this pump.
So let's see where we are at this point now.
Okay.
Remarkable medical discovery going on. Again, we'll go back down into the computer and see if we can get this video to come up. All right, here we are.
So this is a schematic of what we envision. So what you see here is a picture of the brain. And here is a schematic of the brain tumor right here.
Right. It's growing.
It's growing right in front of you.
Sure is, right.
Now, we actually don't use a knife to just cut out like that, but this is a schematic.
Right.
And so here we're taking out the tumor. Okay, and just relate that to the pictures that you had seen previously in terms of what the tumor cavity looks like.
Right.
So after the tumor's out, then the pump is implanted. And you see how it fills the cavity?
Yes.
And then this pump then is then connected via catheter and here's the catheter.
The pump itself is implanted in the brain.
It is implanted in the brain. The catheter is basically coming down subcutaneously, and then this is the pump that's going to be delivering the chemotherapy.
And it's in the chest wall.
And it's in the chest wall, exactly. And you see how there's these canisters here?
Yeah.
That's where the chemotherapy is going to be kept.
The treatment, the fluid.
The treatment, the
right.
fluid.
The medicine.
Yeah, exactly.
Okay. And it's pumped into the brain.
It's pumped into the brain. And what we will be able to do is that we will be able to use Wi-Fi to control what comes out from the canister into the brain tumor.
That's pretty doggone remarkable. And again, this is in the early stages of it. It's been in development, but you've actually got the device now. The device has been created at this point, right?
Well, actually, the device has not been created yet.
Good. As I said, it has not been developed just yet.
Yeah, but what we have is basically we're making a prototype, which we call the Pathfinder.
Well, that's what I meant. A prototype is
Yeah.
you are getting that. You've got that.
Yeah, because this is very complicated because we have a grand vision for this pump that not only allows the pump to deliver drugs, but we also have something called a lab on a chip. Now, a lab on a chip, all that means is that we are going to be taking fluid back from the tumor, and we're going to be analyzing specific cytokines or products that the tumor produces to analyze how the tumor is doing. So one common factor is that brain tumors produce a factor called vascular endothelial growth factor. It's called VEGF. And VEGF basically is produced by the brain tumor to allow for more blood vessels to form so that they can grow more. So when tumors are very aggressive and growing, they produce a lot of VEGF. So our goal is basically to take some of that fluid back into our lab on a chip, and we can analyze how much VEGF level there is. So if our treatment is going well, the VEGF level presumably will go down. And therefore we can know not only by how we're doing just by the MRI scan, but we can know how we're doing by actually sampling the tumor fluid.
Remarkable information on a treatment that may, one of these days, not too far in the distant future, be around to help patients who are suffering from brain tumors. Really remarkable. We'll be back in just a moment. I want to learn some more about this company. Okay, we'll do that in just a moment. Stay with us. We're back again with our guests, Dr. Thomas Chen and Frank Adell. Dr. Chen, what has to happen before this brain tumor pump can actually be put into use?
Well, what will happen is that we are in the process of miniaturizing the pump, and then it's going to be implanted into large animals, and it will then be used in phase 1 trials in human beings. So we're anticipating basically a time frame of about 2 years.
Before it really gets approved by the FDA. That's what you need, right? Talk to me a little bit about this intriguing company, Frank, Pharmaco-Kinesis. What other things are you developing? They're obviously all medical devices, right?
Yes, the technology platform is about a pouch that is going to be made of polymer. Eventually it's going to be inside the body. Eventually it will create blood vessel next to the tumor and other sites that there's a problem. And the oncologists or physician or practitioner are able to receive information and data through the system and wireless through this PDF, and they know what's happening at the real time. So this has a huge application. The first application that company has selected, as Dr. Chen mentioned and demonstrate, is for use of glioblastoma. Later on, the company going to develop the same pump or customized pump for like pancreatic cancer and some of the cancer that what we call unoperative cancer. So the technology is huge and has huge application in many fields.
Well, it's a remarkable story of two remarkable gentlemen, a brain surgeon here, Dr. Chen. I want to point out that Frank Adell, his background really is in nuclear engineering. He was the shield and design engineer for the San Onofre nuclear plant, units 2 and 3.
Yes.
He has a remarkable background, and put the two of you together and look at what's happening. How big is the company, by the way? Is it just the two of you, or are there many
The company
others
is at this time is about 40 people.
40 people?
Yeah.
My goodness. Well, it's been great hearing about all of this. What do you see for the future of the company as you really think about it?
We believe this is going to be another iconic, huge American success due to the fact that we're using a smart drug delivery system for first time to allow physician to communicate with the drug inside the body as process of cures happen, which means gives control over the physician or surgeon to really communicate and administer the precise drug at the right time while we're getting feedback. So I think the future is literally great.
And Dr. Chen, what are the other the doctors who work with you at USC, what are they, obviously they know you're working on this, am I right? Or is this highly secretive at this point?
No, it's not highly secretive, but it's something that we have not published on. It's something that we are still in the process of development. So but you know, the people that we have shown this video to have been very interested in it.
I'm sure. Were you looking for investors to help? I would assume that wouldn't hurt, would it?
No, it wouldn't. We actually closed our first round very successfully. Actually, the period was 2 years, and the money came in 3 months.
Very good.
So we're very successful. We just started round B, and we have strategic partner that we're dealing with because this is a product that will be tailored to actual companies. So,
well, it's been amazing. Thank you very, very much.
Thank you.